Hey therapists, if you're tired of staring at a blank screen while writing ADL notes, this video is your new best friend. Today I'm giving you quick copy and paste, modifiable SOAP note phrases for ADLs that will instantly improve your documentation and save you time. Let's start with the subjective section. What the patient tells you. These phrases work across skilled nursing, rehab, home health, and acute settings. Patient stated, "I want to get back to dressing myself again." Patient reports increased difficulty with bathing due to fatigue. Patient verbalized fear of falling during toileting. Patient expressed desire to improve independence with grooming. Patient reports pain rated 7 out of 10, affecting ability to complete ADLs. Caregiver reports patient requires increased queuing at home for dressing. Patient states, "I feel unsteady when I stand at the sink." These phrases help justify why therapy is medically necessary and guide the rest of your note. If you want the full SOAP Note ADL template, including objective, assessment, and plan phrases, comment SOAP below and I'll drop the full version. Don't forget to like and subscribe for more OT documentation shortcuts. I'm here to make your charting faster, clearer, and compliant. See you in the next video. OTs, are you struggling to write strong objective notes for ADLs? Here is a fast, copy and paste, modifiable template to instantly strengthen your SOAP notes. Start by documenting exactly what you observed during the ADL task. Include the task, levels of assistance, and the deficit impacting functional performance. ADLs, observed, grooming, bathing, toileting, dressing, feeding, and transfers. Level of assistance, independent, modified independent. Supervision, standby assistance, contact guard assistance, minimal assistance, moderate assistance, maximum assistance, and dependent assistance. Deficits may include balance, strength, range of motion, cognition, safety, endurance, and coordination. Here is a sentence builder example. Patient completed blank with blank due to blank. Here is a completed example. Patient completed grooming with contact guard assist due to decreased standing balance. This part shows the skilled work you provided. The part Medicare cares about. Skilled documentation as follows. Types of cueing provided: verbal, tactile, visual sequencing, safety, CLF pacing, or energy conservation. Skilled interventions can be specific during ADL training, such as compensatory strategy instructions, adaptive equipment or assistive device training, functional mobility training, balance retraining, neuromuscular facilitation, activity downgrading or upgrading, environmental modifications, or caregiver education. These skilled terms justify why you, as a skilled OT or OTA, were needed today. Document mobility that supports ADL performance. Insert skilled terms for the following. Sit to stand. Transfer type. Assistive device. Level of assistance. Safety. Concerns. Maria. This paints a clear picture of the patient's functional capacity during daily tasks. This is where you document endurance, physiological response, and effort. Important for showing progress and medical necessity. Endurance should be noted as good, fair, or poor. Were rest breaks required? Yes or no? Make a note and document any assessed vital signs. Note the patient's effort as good, fair, or poor. Comment objective if you want the full SOAP Note template. And don't forget to like and subscribe for more OT documentation shortcuts.
OTs, your assessment section is where your clinical brain shines. Here's a copy and paste template to write strong, Medicare-ready assessment statements every time. This statement summarizes exactly why the patient needs you. Use this easy formula. Patient requires contact guard assistance for grooming due to impaired standing balance, increasing risk for falls. Patient continues to demonstrate poor sequencing during dressing, requiring verbal cueing to complete safely. This single sentence shows what the patient needs, why they need it, and the safety impact. The assessment must show medical necessity. Here are statements you can modify. Skilled OT remains necessary to address deficits in blank to improve safety and independence with ADLs. Without intervention, the patient is at risk for falls, skin breakdown, aspiration, and further decline. Patient is progressing toward goals but continues to require skilled training. Performance is inconsistent due to cognitive impairment, requiring skilled cueing. These phrases prove why OT services cannot be delegated to a non-skilled provider. Always indicate whether the patient is improving, plateauing, or regressing. Patient shows improved safety awareness during toileting transfers. Progress remains limited due to fatigue and poor standing tolerance. Regression noted in functional mobility following hospitalization. Comment assessment below, and I'll drop the full SOAP Note template for free. And don't forget to like and subscribe for weekly OT documentation shortcuts. Let's keep your notes clear, fast, and defensible. See you in the next video.
OTs. The plan tells the payer exactly what happens next. Here's a fast copy and paste modifiable template to write a strong, defensible plan every time. Start with how often you'll see the patient and for how long. OT recommended 4 to 5 times per week for 4 weeks to address ADL independence. Next, identify what skilled OT interventions you plan to work on. ADL task progression, adaptive equipment training, standing tolerance and balance, toileting transfer training, dressing sequencing, bathing safety training, cognitive cueing strategies, and caregiver training. These tell the reviewer exactly what your next skilled session will focus on. Not generic care. Finish your plan with strong intention statements that clearly justify continued OT services. Continue OT to increase ADL independence, safety, and functional mobility. Progress tasks as tolerated using just right challenges. Reassess ADL goals weekly. These statements show ongoing medical necessity and forward clinical thinking. Always remember, number 1, ADL observed. Number 2, level of assist. Number 3, what went well, barriers. Number 4, cueing provided. Number 5, safety issues. And number 6, therapeutic focus. Comment plan below if you want the full SOAP Note template as a PDF. And don't forget to like and subscribe for more OT documentation shortcuts every week.